chamber today, right now?
Unfortunately, no.
So zero, not one single Democrat is in the chamber listening, debating, having a dialogue with you. Question number two, if you're a union worker in my state, Ohio, do these Biden, Obamacare, COVID-era subsidies lower their health costs?
Absolutely not.
If you're somebody on Medicare, no matter where you are in America, do these COVID-era Biden, Obamacare subsidies lower your deductibles?
Absolutely not.
If you get private insurance through a small business like the one I used to own, do these Biden-era COVID subsidies lower your health care costs?
Does nothing to benefit those people you're describing.
If you're unfortunately somebody who is having a tough time and you're on Medicaid, you're disabled, children, do these Biden-era COVID subsidies lower your deductibles or your out-of-pocket costs?
No.
So none of the people I just mentioned, not union workers, not people on Medicare, not people on Medicaid, not people on private insurance, not unions that negotiated incredible rates. None of them will see lower health care costs. Am I accurate in that?
You're absolutely accurate.
Who stands to gain by the federal government writing a check for $26 billion to do what the Democrats want? The money goes directly to the insurance company, correct?
Correct.
It doesn't go through the pocket of the consumer. So if for example, I want to go find a doctor that's going to offer treatment for less money because my deductible's too high, this doesn't help me because I'm not getting the money. It's going to go to the insurance company, correct?
Correct.
And Senator, you're so smart on this topic, and you're the chairman of the Health, Education, Labor, and Pensions Committee. Is that true?
Correct.
Who was the previous chairman?
Bernie Sanders.
Bernie Sanders. Okay. Bernie Sanders was chairman when, again, just to be clear, for
last Congress.
which would have been through 2024?
Yeah, he's for 2 years.
And the Biden-era Obamacare subsidies were extended in 22, is that correct?
Correct, I think that's right.
To expire in 25.
To expire in 25.
So who voted for the expiration date of 2025?
Not Republicans, rather Democrats.
So just to be clear, the Democrats voted to have these subsidies expire this year, correct?
Correct.
To your knowledge, was there a hearing last year in 2024 in which the Democrats got together and say, whoa, these Biden-era COVID Obamacare subsidies, we set them to expire in 25. We should really make them permanent or extend them. Was there a single hearing in your committee about that topic?
There was not.
So, wait.
I had to play that in its entirety because, and that was Senator Bernie Moreno from Ohio and Senator Bill Cassidy from Louisiana, which Cassidy was in the House and was a huge vocal opponent against the so-called Affordable Care Act. And today we're going to be joined by my good friend, C. Stephen Tucker. He's the founder and owner of Health Insurance Mentors, one of the nation's most respected independent voices on the realities of American health insurance. For decades, he has helped individuals, families, and small business owners cut through the bureaucratic fog of the Affordable Care Act, so-called, that's what I call it, and understand how to make smart, cost-effective coverage choices. We'll unpack a question Washington still hasn't answered. What's the difference between health care and health insurance? And why does that confusion matter? We'll look at how Obamacare changed both, what its subsidies really cost taxpayers, how insurance companies became the quiet winners, and whether it's time for the Senate to nuke the filibuster, repeal the SEA, and finally replace it with something that works. See, Stephen, my friend, my buddy, my pal, welcome to Detroit's Morning Answer.
John, it's so great to be on with you.
Now, see, Stephen, you heard that back and forth between Moreno and the senators Moreno and Cassidy. What's your perspective on that? Was that a clear, wide-eyed perspective on what's in front of us as a nation?
It was extremely well stated. We have to go back a bit, a little history lesson. So back when 2 weeks to slow the curve turned into about 2 years of tyranny. Stay home. You're not essential. Take this shot. Shut up and take this government check. Meanwhile, Home Depot was open for years. Hospitals were considered essential. Strip joints, marijuana dispensaries, they were all essential, but we weren't. And so we had to rely, of course, on a government check. And so during that time, when you're relying on a small government check and you're not able to work, of course, you can't afford health insurance. And so the Biden administration passed something called the American Rescue Plan.
Yeah.
This is in 2021, 1 year after the most insane period of my lifetime began. And during that period of time, they increased the subsidy cliff. The subsidy cliff is the point at which someone cannot qualify for what's known as advanced premium tax credits, which we call colloquially Obamacare subsidies.
Yeah.
And so the subsidy cliff prior to the American Rescue Plan for a married couple was about $84,000 a year. And so at that point, if you made more than that, and actually back in 2021, it was like $78,960 at that point. So now it's $84,600 with, of course, inflation. But at that point, if you made more than that, you qualified for nothing. And so the cost of health insurance was double your mortgage for the cheapest plan. And so then they passed the American Rescue Plan, and they cranked the subsidy cliff from 400% above the federal poverty level, which at that time was $78,960 for a married couple, up to just crazy levels, $250,000 a year as a married couple could get massive ACA advanced premium tax credits.
Wow.
And I'm talking massive. And so, for example, if we fast forward to today, right now, and you're shopping for the cheapest Blue Cross of Michigan PPO, it's called the Blue Cross Premier PPO Bronze Secure. It has a massive $10,600 deductible for each of you, you and your spouse. Oh, yes. And so if you buy that plan January 1st and you make $1 less than $84,601, you will pay $1,723.96 for the privilege of that policy, which has a $10,600 out-of-pocket risk exposure for you and your spouse.
Wow.
However, if you make $84,600, right, $1 less than $84,601, the federal Treasury will hand to your insurance company on your behalf on the first of each month $1,070.
Wow.
Which will reduce the cost for that cheapest plan to $653.96 a month.
Wow.
Now you know why this big argument is happening in Washington, D.C., and why so many Trump supporters, like yours truly, want the subsidies enhanced, because the cost of health insurance for them is going to more than double if they don't pass an extension of the Biden-era enhanced subsidies. When they did the American Rescue Plan, then they did the Inflation Reduction Act, and they extended those subsidies all the way till December 31st, 2025. That deadline is shortly coming. When that happens, these subsidies all expire. We go back to $84,600 or less for a married couple, and you got to make less than that, or you get no federal subsidy. You pay these exorbitant amounts. And so that's what's going on. That's what it's all about.
Wow.
And so I think, because I cannot name one federal subsidy in U.S. history that has ever been repealed, I suspect they will extend these subsidies in the first or second week of December. The problem with that is the end of open enrollment. If you want a January 1st effective date, the cutoff is December 15th. And so the whole country is just sitting here waiting, like, can I afford health insurance next year? What in God's name am I going to do? Right? That's the impasse that we're at. And it's just a train wreck. And the only party responsible for it is the Democrat Party. They are the ones who passed this law. They are the ones who passed the American Rescue Plan. They are the ones who passed the Inflation Reduction Act. And they are the party who set those enhanced subsidies to expire on December 31, 2025. Not one Republican voted for any of this nonsense. None of it.
Now, the CBO, now they've projected that in 2023, these subsidies, they total probably around $91 billion. And now
Yes.
they're projected to exceed 1 trillion over the next decade. See, Stephen, how can this American economy afford something like that? I mean, that's an excess, Stephen Tucker. How did we get here, and how do we fix this?
Yeah. Well, we had a chance, okay? If you go back to 2017, during President Trump's first administration, they passed a piece of legislation, almost passed it.
Oh, I
One
remember.
person killed it.
I remember that
Yes.
thumb.
Yes, it was called the American Health Care Act. It was the best piece of health care legislation I have read in 30 years. I was so excited about it. And they had people that actually understood these things, like, for example, Paul Ryan, who wasn't the
Yeah.
greatest Trump supporter, but was a brilliant healthcare policy guy.
Yeah.
And he was the crux of putting most of it together. And it made perfect sense. You could sell health insurance across state lines. They were changing the ERISA law. All policies would be HSA qualified. It was just common sense things, right? And so it came to 2 a.m. and a Senate vote, and a person who's no longer with us, John McCain, while the cameras were rolling, put his thumbs down and killed that bill.
Ugh.
And so that would have dramatically reduced costs of health insurance across the country for everybody. We wouldn't have to print $26 billion every year and hand it to insurance companies to artificially reduce the cost of health insurance. Those things would have never happened. But unfortunately, they are happening now.
Yeah.
What the Trump administration has to do, is they have to resurrect that act. They don't even have to come up with new legislation. They just have to resurrect that act and get it through so that Americans finally have affordable health insurance again.
Well, see, Stephen, if you tell me, do you remember I think you just said the name of it, because I can cut this and send this to somebody I know who gets a lot of my information out to the Trump administration, and they listen to it.
Yes.
If you had to sit down, you were before President Trump to say, because I'm going to recommend that you be a part of this discussion to some of my friends in the Trump administration, because you understand this stuff, I think, better than even Paul Ryan, because this has been your livelihood for decades. So what if you were sitting before the Trump administration and you said, Mr. President, this is the way forward? What is that, C. Stephen Tucker?
So it's interesting, when the American Health Care Act was being debated, right? I did an interview on Chicago's Morning Answer.
Yes.
And I broke down that act. And the key legislator in the House of Representatives who wrote the biggest portions of that bill actually reached out to me and said, if I could explain it as well as you could explain it, this might have actually become law.
Yeah.
That's what he said.
I agree. I agree. Whoever that legislator was, I definitely agree with him.
So it was funny that I got that feedback. But nevertheless, here's what I would tell them, okay? You have to stop governors, for example, like J.B. Pritzker, and governors in 13 other states that are going above and beyond what the federal government allows in order to provide Medicaid to those who come to this country illegally. As we know, under the Biden administration, they left our borders wide open, and they brought in 28 to 30 million people into this country that are not supposed to be here. And the Trump administration is trying to get rid of as many as possible through their immigration enforcement. But what happens when you do that is that because they are not eligible for Medicaid, they are not eligible for Medicare, and they are not eligible for Obamacare subsidies because the law prohibits them from obtaining them. Many of them use emergency rooms as their primary care. And when they do that, this is why it takes you 9 hours to see a doctor,
Yes.
even if you have the best Blue Cross policy, right? And when they do that, those costs are shifted why it's happening, right? Above and beyond that, the Trump administration, when they passed the One Big Beautiful Bill Act and signed it on July 4th, they put a stick out to all governors in 14 states, like J.B. Pritzker in Illinois, for example, who began funding Medicaid for illegal immigrants,
Wow.
not using federal dollars because you can't. The law prohibits them. Instead, he created state-based Medicaid programs, him and 13 other governors, right, and began using state taxpayer dollars in order to fund these Medicaid programs strictly for illegal immigrants. And so when he did that, in about a year and a half, he blew up the projected amount, and the first fund Medicaid fund for illegal aliens in Illinois went bankrupt very quickly, less than 18 months. But there's another one that's continuing right now as we speak. And he's funding it using our massive property taxes in the state of Illinois in order to provide Medicaid for illegal aliens. The Trump administration said that if any governor continues to do so, we can't stop them because they're not using federal dollars. They're using state taxpayer funds, right? Mm-hmm. What we can do is we can reimburse the reimbursement amount that the federal government gives for those who legitimately are allowed to enroll in federal Medicaid from a 90% reimbursement to the state for those recipients to 80%. Oh. So a 10% reduction in reimbursement. That would cost the state of Illinois $800 million every 12 months.
Wow.
Every 12 months, right? And so if the governor of Illinois does not stop funding the state-based Medicaid programs, by July of 2026, that reimbursement cut begins. Okay? Wow. And so that's going to stop him from funding these Medicaid programs. It's also going to stop the governors in the other 13 states who are doing this. And so whilst I say the Trump administration should bring forward the American Health Care Act, they should also continue what they're already doing, and that is penalizing states who are incentivizing illegal immigrants not only to come to their sanctuary cities and sanctuary states, as Illinois is, but then, of course, robbing the state taxpayer to fund those things. If we can take action to stop this kind of nonsense from happening, and we can take action to get rid of many illegal immigrants as possible from this country, the cost of health care, and not just health care, but health insurance, housing costs, food, everything will go down. But it will not happen until we get rid of nearly all of them. Wow. It has to occur.
Wow. See, Stephen, this is, I mean, my jawline is all the way on the floor right now. But, you know, Stephen, Stephen, when I think about the policy debates, I think it has to go back to the basics. Because I think a lot of people think Obamacare solved the health care and health insurance crisis. But there's a distinction as to what the bill actually did. How do you define health care versus health insurance? And why does confusing the two distort any policy debate before it starts?
Exactly. For example, having a health insurance card, for example, does not guarantee that you will receive health care. Especially when you have to wait 9 to 11 hours to see a doctor in the emergency room when you have private health insurance, right? Yeah. It does not guarantee access to health care when we flood the system with those who should not be here, right? Yeah. And so there is a definite correlation and a separation between the cost of health care and the cost of health insurance and health care delivery and health insurance, right? Yeah. But for so long as the cost of health care is skyrocketing, the cost of health insurance, of course, will be correlated. It will keep going up and up and up. And if we don't propose new legislation, such as the wonderful American Health Care Act, if we don't resurrect that, and we just keep printing money and handing it to insurance companies, this is a recipe for disaster. You have to understand, when Barack Obama said and promised, family of four, for a premium reduction, $2,500. It's the right thing to do, right? He promised we would all save $2,500 a year. The cost of health insurance has increased by 286% since our former dear leader's promise that he would reduce the cost of health insurance. Furthermore, the same number of Americans who are currently uninsured, which was roughly 30 million before the wonders of Obamacare began, is the same number who is uninsured today. So what the hell do we do all of this for?
I'll take. Well, this might be it. When you think about the top 5 insurance, United Health, CVS, Aetna, Cigna, Elevance, which used to be Blue Cross, Anthem, and Humana, they've captured over 70% of the private market. They had 40% in 2011. How did reform create monopoly power, Stephen? It's the insurance companies.
We lost 148 health insurance companies since 2010. They're gone. 20 health insurance companies have exited the state of Illinois. The last one is leaving on December 31st, and that's Aetna CVS Health. The insurance company before that was Land of Lincoln Health. I have watched these companies evaporate since our former dear leader's fundamental transformation of the American healthcare system began. And when those smaller carriers who compete against the bigger carriers and are able to offer lower prices evaporate, you create the biggest monopoly in American history. And that is precisely what we did with Obamacare. Name for me the number of carriers left offering health insurance.
I can't. I
You
personally can't.
It's like five. It's like five in Illinois. It's like four in Michigan. And the vast majority of them are offering HMOs only. You have to understand, in the Midwest, there are only 2 states left that offer PPO policies in the individual marketplace, Illinois and Michigan.
Wow.
That's it. Half the states in America only offer restrictive HMOs. And if you've ever had an HMO, you know how bad it is compared to a PPO.
Yes.
Half the states in America don't even offer PPOs.
I got to wait. PPOs, I can go where I want. HMO, my doctor has to tell me. But, Stephen, we got about a minute left. And I'd be remiss if I didn't bring up Health Insurance Mentors. How can people who want to know more about this learn it from you? And how can, if there's a small business, an individual who truly wants an education in this, how can you help them?
So they can visit our website, healthinsurancementors.com. Everyone needs a mentor, especially with Obamacare. And Medicare, which is so much better than Obamacare. It's not even describable. You can't even compare the two. If you have Medicare, your deductible for the whole year is $257 for all medical claims. Can you imagine? And you might pay $350 a month for all parts of Medicare. It is incredible, but you have to get there. Right?
Yeah.
I have so many people who have Obamacare in their 50s and they're paying twice their mortgage payment, and they're doing everything they can to age as fast as they can to get to the healthcare promised land, which is Medicare.
Hey, Stephen, what are you doing this Saturday? You should probably join me in studio and we break this down Saturday if you got some free time.
Well, I would have to fly 1,200 miles north.
You bum. All right. C. Stephen Tucker, owner of Health Insurance Mentors. Thanks so much for joining us this morning, my friend.
Always my pleasure, John.
I miss you, my brother.
You too.
All right.
Bye-bye now.
Bye now. We'll be right back.